This is the Monday edition of the country's #1 television breakfast show, and we're excited that now we should be getting into our health corner. And today we're focused on, cancer, and which is why we are joined by, Dr. Monza with us in studio to help us understand what is being done to encourage, early screening. Doc, good morning.
Good morning. How are you?
Yeah, no, I'm good. I don't know about you. What were you up to over the weekend?
Spending time with family. Don't get a lot of that.
You were not on call, eh?
No.
Hey,
I am today, though.
Oh, today?
Yes.
Today it's a normal day.
Yeah.
It's a normal day for such things.
It is.
And it's a great day to be busy, hey?
Yeah,
it's a Monday.
Put it that way, yes.
Yeah.
All right. So at least you did have some time to yourself and family as well.
I did. I
great.
Did.
Yeah. Okay. All right. So today we're focused on breast cancer. And generally, tell us about the month of October and how it's important in as far as cancer is concerned.
Okay, so October generally is a very special month to everyone because of breast cancer, obviously. But it's also the month of my birthday, so that makes me happy.
Oh, okay. When is your birthday?
On the 27th.
27th,
Yeah.
after independence?
Yes.
Well, we shall wish you a happy birthday in advance.
Thank you.
Yeah.
Thank
Because
you
we will
very
not have the
much.
privilege of having you on the show before, on that particular date.
That's okay. Thank you very much.
Please make sure you enjoy, yeah?
I will.
Yeah.
But more importantly, the country, Zambia is a relatively young country with regards to medicine in comparison to other countries, and even treatment of breast cancer, it's still evolving. And so even the dedication, it's a worldwide dedication, but it's also important for our country because people are getting a little bit more aware of it, and they are removing the stigma of having this problem on your breast, because it's not easy to just walk out to someone and say there's something wrong with my breast.
Yeah.
So it's important for the healthcare workers because we're also people as well, and we also get it, and it's also important for the community. We want our community to grow older. We need to enjoy our years, and breast cancer is one of those things. If not picked early, people do actually lose their lives, as you mentioned earlier. But once it's picked early, we are able to treat it early, and we actually can cure people of breast cancer.
Yeah. How much information do you think is out there regards breast cancer?
There's quite a lot of information, but not enough.
Okay.
As we speak right now, I'll be speaking to the masses, I'll be speaking to people, and I speak to people at work as well. But what about that person who's in the depths of Mporokoso, for example, that doesn't have a TV, doesn't have a radio? We talk to them in the clinics. Some people are they don't have enough time to get this information in the clinics because we have awareness clinics, we have screening clinics, and not everyone has the time to leave their home where they should be fending for their families and getting back to the hospital to get this information. But there is information, and it will get better even after today. We will get a little more information.
All right, let's talk about the screening. What is involved in screening? Is it something very complicated? Is it something that takes too long?
No. Screening starts from the conversation.
Okay.
It starts from you coming to the hospital, and it starts with explaining what is going on. Okay, so you will find a woman has noticed a change in her breast. Sometimes she doesn't even notice. Sometimes they're just things that will connect her to thinking about how she might be at risk of cancer. And so she'll come and say, okay, my mother had cancer, my mother died of cancer, or my sister died of breast cancer, and I would like to know what's happening. So it starts with the conversation. We now try to find out what risk factors that you have as a person and what changes you've noticed, if any. And when we get to a point where the suspicion for breast cancer is higher, we now start the more scientific screening or the more medical screening, where we do lab tests, we do biopsies, we do imaging rather. So we start with the lab tests, we do some imaging, and eventually if there is a lump, we will do surgery to get a piece of it and take it to the lab for confirmation.
Okay.
Yeah.
So I'm told that you basically examine.
Yes, we do examine.
So you can tell.
Yes, you can.
Yeah. So let's shift the conversation towards symptoms.
Before you shift the conversation, still on examination, in the past you've encouraged women to do it even from home. What are the telltale signs that they should look out for a woman that can't come to the health center?
Okay, so it starts with knowing you're normal. That's where the telltale signs start from. You know you're normal, then you will know that something has changed. So we tell women to examine their breasts, and if you know what's normal for you, you'll be able to see what is going wrong. You will feel a lump, you will notice skin changes in your breast, you will notice, I'll give you an example of an orange actually. If you look at an orange, it has this dimply look, it has dots on it, and we actually call that peau d'orange, where your breast starts to look like the peel of an orange.
Is that English?
No, it's French actually.
Yeah, I thought so.
It's French for peel of an orange.
Okay.
Yes. So your breast starts to look like that. Sometimes you find that they have a weird discharge from their nipples. If you're not a breastfeeding mother, we don't expect your nipples to be discharging anything. So if a woman comes and says she's got something coming out of her nipples, whether it's yellow,
so should you
green,
try and actually express, or the discharge comes out on its own?
sometimes it comes out on its own, other times you can express. But that's when if you're expressing, chances are you've already noticed other things before trying to express your nipples. So that's one other thing. Sometimes it won't even be any changes in your breast. Sometimes it can be changes in your armpit. You start to feel a small node, a lymph node in your armpit, or a mass. And this, again, should not be a normal occurrence. So when a woman finds a lymph node in her armpit or a mass in her breast, this is enough for her to come to the hospital and say something is wrong and I need help. And I need to be seen, yeah.
Okay. So I think we already crossed the path to symptoms, right?
Yeah.
Yeah. What about men?
With the symptoms?
No. Are they also...
Are they affected?
Yeah.
Yes. Much rarer than women, actually. Okay. But men are also affected by breast cancer. Men also get breast cancer. Unfortunately for them, when they do get breast cancer, a lot of the times it's quite aggressive. And it's already, by the time a man will come to the hospital and say there's something wrong with my breast, he's already in a late stage. Because again, there's that attachment to shame and talking about the breasts generally. And men, being men, you want to muscle it out first before you go to the hospital and seek help, yeah.
Men being men.
Yeah.
We want to muscle it out before you actually seek help.
Yeah.
So, is there a common age among us females that are prone to breast cancer?
Common age, I would say there's no one set age, but the risk of getting cancer gets higher with age. Unfortunately, in Zambia, we have treated some very young ladies. I know in my short practice, I've seen a lady as young as 29 with breast cancer. But it's not as common in the young as it is in the old because of this exposure to other risk factors like estrogen and a lot of other things that will cause a person to get breast cancer. So when you're approaching your 40s, your risk starts to get higher, and these are the women that will present to us more than the younger ones. Yeah.
Okay.
So how often should a woman do screening?
Self-screening every month. So if a woman
every month
self-screening
at
home, yes. Just go stand in front of the mirror, do a great examination, feel your breasts and see if there's any changes. Again, I will repeat, know you're normal. Yeah. But screening at the hospital, we encourage at least 1 to 2 years as you cross the 40 mark.
Okay.
Yes.
I don't know whether it's true that breastfeeding mothers have got a lesser chance of having breast cancer.
Yes.
I'm not too sure. Explain the rationale behind that.
Okay, so breastfeeding mothers do have a lower chance of developing breast cancer because they are, in that period of breastfeeding, we know that a woman will not be having her period as long as she's in that lactation period. We call it a lactation period. So amongst the risk factors that I should have mentioned earlier is this exposure to estrogen. So any woman women that are starting their periods a lot earlier and women that are ending their periods a lot later in life have this prolonged exposure to these hormones that increase the risk of developing breast cancer. These hormones are normal to us, but the mere reproductive period makes it even higher. Your chances are even higher. So in your breastfeeding period, your exposure to estrogen drops a lot to very minimal levels. So the more you breastfeed, the less exposure, the less your risk of getting breast cancer.
Are there things that women can do on a regular basis to just
lower their risks.
Lower their risk. Thank you, Mson.
Yeah, they can, starting by working on the risk factors. So we want to drop your risk of getting breast cancer. So you work on your lifestyle. So we have things that we call modifiable risk factors, or things that can be changed. You know, alcohol intake. I know someone would say reduce alcohol, but I would say stop taking alcohol altogether. Smoking, you can have a more active lifestyle, exercising, maintaining a good weight, a healthy weight. I know in Africa generally there's a notion that we are very voluptuous women. We are on the heavier than lighter side.
Yeah.
And so even if you're on the heavier side, you can be a healthy, heavier person. Obesity increases your risks by a lot, actually, your risk of getting cancer. So working on your weight, stopping to take alcohol, reducing your smoking or stopping smoking altogether. Having children, I didn't mention this, but having children is actually very protective. The people that are without children, always say nulliparous women by choice, have a higher risk as well of developing breast cancer. So if you can have children, have those children, you know. And also the breastfeeding that you mentioned, breastfeed for longer. I know it's difficult as a working mom, but it's one of the things that's actually protective with breast cancer.
Is it true that breast cancer is one of those cancers that spreads really quickly and quite difficult to treat? Because then we see a lot of women that have gone, for instance, into remission.
Spreads quickly, it's a yes and no answer, because there are different types of breast cancers. So depending on the breast cancer that has been diagnosed.
I thought it was one type.
One size fits all.
No. We have different types of breast cancer. So if you allow me to get deeper into the types.
Please do.
There's the breast itself is made up of different types of cells, different types of tissue. So we have ducts, the ones that transport the milk to the nipple, and then we have glands. So a breast cancer can develop in the ducts, that's called a ductal carcinoma, and it can also develop in the glands, which is called lobular carcinoma. So depending on which one type you've developed, it can be a ductal which stays in the duct and doesn't spread, and it can also be a lobular that stays in the glands and doesn't spread. But if it spreads again, that's another type of cancer. It's called invasive. So when you have, for example, a lobular carcinoma, it started in the gland, but it has started to spread out into other parts of the breast and eventually other parts of the body. That's now invasive carcinoma. So if you have a woman that has been diagnosed with breast cancer early and she has started treatment early, whether it's surgery or chemotherapy and radiation or hormonal therapy, these women have a higher chance, and you can actually be cured and go into remission, you know. But if it's found late, say in a higher stage of the breast cancer, then we will still work at treating you, but then we do what is called palliative care.
Palliative care.
Yes, palliative care is where we are now just improving your symptoms. You've got the cancer, and unfortunately it has spread to outside of the breast tissue. It's gone to your back, it's gone to your lungs, it's gone to your kidneys, it's gone to other parts of your body. Now we just improve your symptoms, but the cancer is still there.
Okay. Anything else that you
love
think
to enlighten us with before you?
I will say that breast cancer itself it's not the end of the world. When the diagnosis is made, it's not the end of the world. And after everything that we've talked about, your risk factors, knowing you're normal, your chances of survival are higher if you catch it early. So if you start your own personal screening at home, and the moment you notice something different, you go to the hospital, and if unfortunately it's found, but fortunately it's found early, then your chances of survival are a lot higher than someone who ignore the changes and not do anything about it.
Doc, thanks a lot. It's always a pleasure
having you
so much. Come through here.
Thank you.
This has
been
time
wonderful.
Today.
Yes.
I'm looking forward to having you more, so we could have these discussions further.
Thank you. Thank you so much for having me.
Such an honor. This is the Monday edition of the country's #1 television breakfast show. We dash into the kitchen now and have a look at what's cooking on our Kitchen Drip segment.